Well, here we are, Renee, another episode and a new guest.
I know. I'm so excited to meet Jill today. Hey, Jill, welcome to the
Hello.
party.
Hello. Thank you for having me today.
So, Jason, before we kick off with Jill, what is going on at the farm mid-December?
Well,
What's happening?
there's holidays coming up, so that means, of course, my brother-in-law sold corn that, of course,
Mm.
has end of the month delivery. So, of course,
Mm.
I'm spending all my extra time running out in the cold and sitting in line at the ethanol plant hauling corn. And every year I get crabby around the holidays because I'm hauling corn. And you know how much I love to haul corn, Renee.
Yeah, you like to complain about that. There's usually, though, at least a peppermint mocha or two involved, so that makes it a little bit better, right?
Well, you also have to put in perspective where I haul corn. I don't even pass a town for the 30-mile round trip
Um,
to the ethanol plant. It's even out of my way to find a Casey's to even try to pick something up. So I've got to be pretty self-sufficient. I've been looking at one of those mocha machines that's like fully automated where I just stick the
mm,
milk in and it auto froths it for me. I think I need one of
there
those
you
at the
go.
farm. My brother-in-law is not approving that purchase though, with farm funds. So I don't know what I'm going to do. I guess I'm just going to stick with my K cups and just make do.
Just
This is the
make it
life of a
work.
farmer. It's tough, right? We got to be out there on our own.
Yep. So, Jill, that's why it says the whiny farmer intro at the top of all of our podcasts, because he's always got something to complain about. Jason's a true farmer. Not even the holidays stops him from coming up with something to complain about.
Right.
So, Jason, you've met Jill. Tell us how you've met her and what's Jill all about, Jason?
Well, I don't. That's why Jill's here. She's going to tell us what she's all about. I got connected to Jill through a mutual connection. And you know how we love to network, Renee. We're always out and about, all across the Midwest. We're at conferences or even here in our home state, kind of like where are innovative things happening? Where is the stuff happening that kind of mirrors some of the stuff that we've done with other groups, in our work as consultants. And that's kind of where I met Jill. And so Jill and I jumped on a Zoom and talked and caught up. And I'm like, you know what? We'd love to have you come tell your story with us on our podcast because this is what we do when we're out speaking on the road is we like to highlight, these are innovative things we've seen work and it helps bring hope to those other communities that are struggling to kind of figure out how are they going to create connections? How can they do a better job with limited resources? And I think that's why it's great to make connections and to elevate some of those really cool stories that we see happening and those cool programs that are being developed, those unique partnerships that come about because then we can take and share that with others and they can figure out if they can do that or if they can find funding, that there's other models they can look at and learn, right? Because that's really what it's all about is how can we learn from each other and create and design things in our own communities. So with that, Jill, welcome to our podcast. I teed it up really huge, so I hope you can make it. As exciting as I made it sound. So welcome, Jill. Tell us a little bit about your background and kind of what you're doing right now.
Yeah, thank you, Jason Renee. I'm happy to spend the time with you both today. I'm Jill Barr, and I serve as the outreach navigator for Clay County Behavioral Health LINC, which we'll learn more about today. This was an effort that has been championed in Northwest Iowa. So our population, just to put it all in perspective, for Clay County is about 16,500, with the town of Spencer being a little over 11,000. And so drawing on my past experience, which my past experience is in media education, I was a project coordinator for a CCBHC grantee focusing on partnerships and outreach. Also in my spare time, I like to volunteer for various nonprofits in the arts and culture sector, arts and culture space, excuse me. And with that, I just really have a diverse skill set and a really diverse and wide network. And so I love getting to know people. I appreciate public speaking. I'm maybe being the minority there, but this has been a great role for me. And it has really been a great experience working with my community partners to really build LINC from the ground up.
Well, let's start with what does LINC stand for? Renee and I have this whole going thing about acronyms because no matter where you go, every acronym stands for something different. And so we play acronym bingo sometimes when we go places, just to try to figure out. So tell us, what does LINC stand for? Or does it stand for anything?
Yes, so LINC stands for the Local Initiative for Networking and Collaboration. And you are absolutely right. There are thousands of acronyms.
I like saying it out loud because I think when I hear local initiative for networking and collaboration. That means a lot more to me than just LINC, right? Because it really describes, I think, the work that you're doing. So tell me about how, I'm not going to say the acronym, LINC, Local Initiatives for Networking and Collaboration. Tell me how that came to be and what the work is you're doing today.
Yeah, so the LINC project began in Clay County when a family experienced a tragedy. They felt that their experience with the mental health system was less than satisfactory. And I thought it would be really important today to share the words from the family themselves with you both. These are publicly displayed at the Spencer Hospital in the memoriam, but I just thought this really sums it up very nicely. In December of 2020, our family experienced the unbearable pain of losing not one, but two members of our family. Our beloved Alex, who had suffered greatly with mental illness, took his life at merely 31 years old, while his mother, Julie, who also suffered from depression, died of a broken heart 10 days later. Our world has always revolved around our family, and the magnitude of this loss was immense. We knew that there was a community need for cohesive and comprehensive mental health care and that we wanted to help somehow. Our family helped start the conversation that resulted in the development of a team, including a behavioral health navigator, to increase awareness and coordination of existing services, enact new service opportunities, and to assist those in need. We're strong believers that mental health care is one of the biggest and most important challenges of our time. We hope to prevent what happened to us from happening to others, and it is our hope that our contribution will continue to move mental health care forward in the forward direction for years to come. So I'm going to take a moment from that to thank the Larry and Shirley Olson family, that the lives of Julie and Alex inspire a continuation of caring for others who find themselves caught in the crosshairs of our catastrophic mental health crisis. So that was words directly from one of the family members. And so this fund and this discussion was really kind of what kicked off creating this navigator position and this effort that we now know today as LINC.
And when did it start, Jill?
So we had a stakeholder study that was done in 2021. And let me tell you a little bit more about that if I could, because I think that also, it doesn't really reveal a lot of things that we don't already know, but I think it gives a little bit of an insight to kind of how the initiative was built from the ground up. So the stakeholder study, again, it started in 2021. It was facilitated by the Colley Johnson Group over a 1-month period, and it had stakeholders that included our hospital and our clinic, our mental health and disability service region, Care Connections, City of Spencer, representatives from Judicial District 3, law enforcement, our police department, our sheriff's office, board of supervisors, local behavioral health providers in the community, schools, members of the faith community, and then family and consumer representatives. So a really wide number of stakeholders. And so the gaps that they found included the workforce shortage for outpatient care, number of inpatient beds. So Spencer Hospital, we're very fortunate here to have an inpatient unit. We do have 14 beds. It was 15, but we are getting ready to convert one to a security room so we could expand and take a few more cases, which I think is great, but it's all for adults. So nothing for youth, geriatric, aggressive patients. And then it also revealed a gap for crisis services, which from the time that this study was done to now, that has really been built up and grown, and that's very exciting. And then the last thing was the communication among the providers and responders. The stakeholders, they were unaware of all of the resources and what the processes for referrals were. And then education for consumers, caregivers, and providers. So overarching finding of this big study was that there was a lot of resources out there and evolving resources, but nobody knew about them. And then there was
that is what we find all the time. 100% of the time, 100% of the time. In small hospitals, like Spencer would be considered a rural small hospital, they have a lot more opportunities out there than they know. And then often the hospitals that we work in, they'll be very frustrated because persons with behavioral health needs will end up in their emergency rooms and stuck, but there's nowhere to go, right? But there's people in the community that would be able to help if they knew it existed, right? And so that's part of the job that we do. And I'm sure that's part of what drew Jason to this conversation, is because we see this all the time. So that's very exciting. So in this community stakeholder, you have an advisory board. So what type of people are helping advise this and look at this? Who are kind of some of those stakeholders that pull all of this together?
Yeah, so the advisory committee, right now we have representatives from Spencer Hospital, from Care Connections of Northern Iowa, Season Center for Behavioral Health, Rosecrance Behavioral Health, Clay County Public Health, Lutheran Services in Iowa, Spencer Police Department, representing the city, and then the Spencer Community School District. So I am so thankful for the number of people that we have sitting around our table, because we really are working together and having those conversations. And there's a viewpoint that is brought in from each of them. And I think that's extremely important in the work that we're doing.
Forgive me if I missed it, but did you mention having any law enforcement at the table with that conversation?
Yep, we have our Spencer Police Chief joins
Yeah,
us.
that's the piece that, and the jail. When we are in the small communities, the jails end up being the de facto place where folks that need a lot of help go. And
Mhm.
sometimes they're even more frustrated. So one of the hospitals we worked in really far north Minnesota, there was almost lawsuits between the emergency department and the jail and the staff that were, the police bringing people back and forth because everybody was pointing at each other about whose job it was to help the people. And they're bringing lawyers in that you shouldn't be dumping them here, shouldn't be dumping them here. And it just turned into this big battle. And because they'd had some public situations where things didn't go well. And so unfortunately, this is a very common, and that's why this is so exciting, I think, because you can talk about how this is changing. So this is your job, is to help, I'm guessing, network and bring these people together. So talk to us about the job itself. What does that look like? What does that do? We know that you did a study, you found a need. So what is LINC doing to try to connect this? What's working for you?
Yeah. Well, I'm going to back up one second just because I think
Yeah.
it's important to also bring in how this is funded.
Oh, yeah,
Just as an
absolutely.
idea, for
Yeah.
people out there in your
Mhm.
audience. But initial funding for this, as a 3-year pilot, and we braided contributions between our local government, which I think was very exciting. The Spencer Regional Healthcare Foundation, which was the folks that we had mentioned before in that memorial fund, and kicking off, like that's helping keep this going. And then also the Spencer School District, and then our local behavioral health agencies also provide as well. So when we look at it, everybody kind of has some stake in it, in the success of making it work. And so I think just if you have other listeners that are interested in having conversations about that in their community, I think that's probably important to share that with it. And we're in year 2. We just finished year 2, actually. So we're on our 3rd year of this pilot, and really LINC, we serve as the table, right? So the providers can gather, they can communicate. That's kind of the best way without saying the acronyms all the time, but we're the table. Come sit around it. And when we say providers, I also use that term really widely too. That includes your behavioral health agencies, administration, supervisors, clinicians, peer supports, law enforcement, schools, and more. Just if you're involved in behavioral health and somehow you have a seat at the table. And I think that that's also really important, to get different viewpoints from different people that are doing the work.
That's really cool. We use meeting at the table all the time as part of one of the topics that we talk about, but I haven't thought about it from that perspective. There are some states now that are calling things convenings, where they're actually convening people and bringing them together. And that's what every small community needs, is somebody who will just bring the people together. Because there's, as you know, so many amazing people who want to do good, but they don't know how. And then some of them have money, some of them have time, some of them have all these different things, but they just don't have that person to kind of bring them to the table so they're all working on a common goal. That's really exciting. I'm glad to hear this is working in small towns, Iowa, because man, it's so needed. And you're finding out there's so many more resources than you knew existed. There's
Right.
just so many more partners.
Right. And I learn new stuff all of the time. I mean,
Yes.
and as you both are well aware, the landscape is changing constantly. Sometimes the players are changing constantly. And so to be able to have a way for that communication for people to stay informed of who's where, who's doing what, and a lot of different programs that are starting, some programs are ending, just trying to keep that communication open and out there, I think is important, because one of the things that was also revealed in that study, is the time constraints of the people. And so they wanted to bring on somebody that had the time to devote specifically to communicating, facilitating, and doing all the things. So
Yeah, I really think that this was a very progressive, what you're doing. And I really love the braided funding. I think that is so applicable, and could be utilized in so many communities. A lot of the communities we worked in, Renee, had different resources going to different places that weren't used effectively. And when you look at braiding funding together, and there's a new term that's being used across the country. I'm hearing it in Iowa more and more, is that community health worker. Right. And so really that's that liaison. And so the healthcare world is really embracing the community health worker kind of model as being what you do, Jill. That's really that connector and navigator, really replacing all of those words that have been misused over the years because we get so confused around what's a care coordinator, what's a social worker, what's a case manager, and so really going back to the public health perspective of community health workers are those folks who make the connections in your local community that know where the resources lie, and so there's a movement nationwide. There's also a movement in Medicaid. It's a funded service to move folks to that model of community health workers and really looking at social drivers of health, which is really what our local rural hospitals are tasked to do, is look at social determinants, and what are they doing in the local communities to make the entire population healthy. And so I'm really, intrigued by this model, Jill, because I think it really kind of takes the best of all of those things and puts them together and provides a roadmap for local communities to braid their funding together and make an impact in a way that's meaningful for the entire community. And so I really, I think it's great. I love hearing you speak about this because I think this is a great model that other communities should be looking at.
Thank you. I appreciate that. And, we have so many different groups and providers. And, for example, our folks at NAMI, they can be working with the community and out, but, I'll be working with the providers to help facilitate that communication. And so there's a couple different layers to it. And I think it is progressive. I agree. And I'm so happy to be doing this work.
Give people like specifics, like just some, like what are some nuts and bolts? What does this look like? I mean, right? We're talking about like the concept and it probably is just as easy as it sounds. But what are some of those, specific things that you've seen, like connections maybe that have been made or people that have been brought together? Talk to us about like, what are the possibilities here for people that are listening and they're like, wow, I'd like to do something like this. So do you have any success stories or things that you've seen that have worked or whatever? Talk to us about like, how does it work? What does your day look like? I mean, what are we talking about here?
Yeah. So I have a long list of all of well, not all of, but a lot of the things that we've done. But I'll probably start with the most popular thing that we have done. And we started this 2 years ago. This is a partnership between myself and our public health department, is called these provider resource events. Very simple. But quarterly, we bring people together. We have a specific topic. So instead of just okay, let's gather together, give an update. What are you doing? What are you doing? What are you doing? This is more focused on a specific topic. So we have talked about children's services. We've talked about behavioral health, addiction, recovery resources, housing and transportation, physical wellness, dental, and we will be talking about the criminal justice system coming up. That has been extremely successful and extremely popular. We average, now keeping in mind kind of the size of Clay County, but we average about 32 participants during a day. They give up a couple hours of their day to meet and participate in this. That's 22 organizations on average. And then we typically have about 12 designated speakers in that area of their expertise. So, when we say, hey, the topic is going to be children's services, anybody that their work correlates to children's services can come share. And we've made so many great connections at these. These are very well received. It's a really simple concept, but everybody really likes them because they are that dedicated 2 hours out of the day where they can sit and learn. They can then network with their peers, learn the faces, learn the names. We talk about how do you refer somebody, tell me about who's eligible. So that way they can come away with some tangible pieces of information that they can take and then use in their work. And so that's been really great. We love doing those and we'll continue to do those. We created a website, but this one is specific to just resources. And I know you say resource website, that's pretty common, but we've tried to make it a little bit different in the fact that when you go to this site, you'll be able to find eligibility, referral instructions, requirements, additional contacts. There's food resources, blog content, which you can take and, if you need content to share for your social media, which I did note, LINC itself, or Local Initiative for Networking and Collaboration, does not have social media because our providers are the stars of the show. We want to promote them and the work that they're doing, not necessarily the person behind the scenes. And so it's really working to push them out and share and have just a succinct spot where people can go to listen to interviews with a psychiatrist or different topics that are all relating in the behavioral health field. So we did that. We created a wallet card, which I show some here with a QR code. So we have those. I put those in our chamber welcome baskets. I distribute those in various areas around town. Just, you never know, so we want that information to be out there of here's how you can access that. And that is yourlinc.org if any of your listeners want to check that out. We also I do a newsletter where we share different information between each other. We do 988 awareness. If you all know that Clay County is home to the world's greatest county fair. And so I'm very fortunate that they allow us to put some awareness signs up on grounds. So when those 300,000 plus people come visit Clay County, they see that message from 988 and a little QR code again to scan if you need resources. Did a project with the school where we made 988 Your Life Iowa stickers. So, we put in the restroom on the mirrors. Those look really, really nice. We've done resource bags for our emergency department that have they have a magnet that says like, what's next? So when they get discharged, they can have something, hopefully that will have a little staying power, that they can look, hey, we have crisis stabilization. We have outpatient, we have, there's a couple different choices so they can make, or have an idea at least of other things that are available to them in their time of need. I attend meetings with our ministerial association. I think that is a huge connection to have made is our clergy in our area because, a lot of folks seek their counsel there and how do we work together for the betterment of our community. Partnered with the media to get the word out. Again, I shared a little bit about the website, but our Spencer Municipal Utilities Channel 3 has been a wonderful partner for having guests on the Spencer FYI show. We're working together to create that video content that people can share, they can go back and refer to. I very much appreciate their partnership with that. Our radio stations have done awareness pieces for us. There's a lot out there for that, and I'm thankful. I've done presentations to, our service groups, our Kiwanis, our leadership Spencer group, because we're always looking for champions in our area to talk about behavioral health and to start leading by example. We've had coffee and conversations. I partner with the First Responders Foundation to help. We've facilitated wellness checks. It happened in July, after our catastrophic flooding in Spencer here, but having a clinician to check on our first responders. We just actually are doing follow-ups to that right now as we speak. But thankful for partnering with them, because one of the needs that was identified in our advisory table conversations was a need for somebody local that had that cultural competence, that first responder background. So we had been, it took 1.5 years, but we do have somebody now that has some of that cultural competency that is able to serve our first responders. And so she's partnered with them as well. First Responders Foundation is out of Omaha, but this is kind of an extension in our area. And so we're caring for those folks as well, which do so much for us. See, we partner with our school. We did like a be a lifesaver campaign, again, sending out that 988 information. Did that in tandem with public health again during conferences. We're present at conferences for resource connecting. I've helped facilitate putting some providers together to do lunch and learn, being available for resources for staff. And I've also worked with the workforce learning coordinator there through the school and the chamber to talk about, can we put together some of these no boundaries experiences or extended career experiences to where we can talk about that workforce shortage and address that and kind of introduce these careers to our students. I participate in, a lot of the coalition groups like our Hunger Coalition. There's a treatment and coordination meeting that has more of our law enforcement, jails, parole, drug court. We have great conversations there. There's a community action group, a housing team that Clay County has, which is also wonderful. And then a big thing is advocacy sessions that we have, host 2 of those a year and then more, as needed. But we get together with our elected officials, the state level. We have some federal come in and just have great conversations. We're very lucky to have the folks that we have now, and we just want to make sure they're aware of what's going on in Clay County as well and how they can help. And then I just facilitate a lot of discussions. So lots of discussions between our emergency department, the crisis department, and the region, law enforcement, judicial, hospital, like just getting the people in the same room, which was a challenge before, but having them there to have those discussions on processes and how are we doing this and how are we doing that. And I think everybody has a great mutual respect for what one another does and how we can take action and do that. So that is I feel like that's been a long laundry list, but we're busy and always looking for things and different ways to connect people and to connect all of our providers together meaningfully.
Yeah.
Yeah.
Well, I'm really
I
excited
think,
that you mentioned parole because that's
yeah.
my baby right now is parole. And out west in Iowa can be really hard for people re-entering the community that, where they've made some really terrible choices and they're trying to re-enter, or they've had addiction and they've had mental health issues that drove them to those choices they've made. And so it's really cool that they're at the table and part of your conversations because it can be tough to get people connected. And it isn't, again, because you don't have the resources. It's just because people don't know. And so what's really cool about your website, I know there's a lot of them, but it's really important because it's up to date. Lots of people make a list, right? And it's this piece of paper, and then you never touch it again. And then like 5 places are closed and all this stuff. And so that's the piece of paper that gets handed out at the ED over and over. So it's really cool that you're working really hard to keep it fresh and up to date and making sure that people are connected to a phone number that somebody will actually answer. Because, man, if you're a person seeking help, that's nothing worse than you're trying to call the provider you thought you could call and then nobody answers or whatever. And then people give up and they, when you're struggling like that and you've got a lot of things against you, one phone call may be enough to say, just forget it. The world's against me. I'm not going to keep calling. And so it's really, really important. And the work you're doing is just fantastic. So I just want to say from the bottom of my heart, man, goodness, this is awesome. I'm just so excited. And I'm grateful to hear that you're open to conversations with maybe other places that want to give this a shot, because this is what it's all about. Jason could go about this about all day, but so many people are trying to navigate and then they don't even work together. And so then it's just confusing. And then, so this is cool.
It was so refreshing to hear the long list of
Oh my
partners
gosh,
because
amazing.
I was like, we should have just asked, who don't you connect with in your community? Because the list would have been much shorter. And it's so refreshing because so oftentimes there's not that convener. And I think that's really the secret to all of this is
Oh, it's
having the
so cool.
convener there. And the other thing that I picked up on that I think is really important that makes your work so much more successful is you all aren't trying to take credit for it. You're trying to elevate up all of the providers across your local community network.
That's cool.
And so oftentimes we go into a community and everyone has their areas, this is my zone. Don't cross over into my zone. And there's not that convener that's there to promote everyone. You know what they say about, all boats rise together. That's really what you've been able to do and embody and bringing everyone together, promoting everyone across the board. And I really think that as communities think about how do they do this type of work, I think those are really key elements, right? You include everyone, but somebody has to be there to keep that convening moving forward. Someone has to be there to kind of help push everything as it goes. And I really hear that's the work that you're doing. And so I think that that's really what's so impressive about this effort is really keeping everyone moving together in the right direction. And so oftentimes when we go into a community, everyone's just going in their own spots. Everyone's going in a different direction. Some people are going 1,000,000 miles an hour. Some people are going 10 miles an hour, and some people are going backwards. But what's really important is thinking about how do you move everyone together forward. So thank you so much for sharing, Jill. I think it gives us all a perspective as to how can our local communities do a better job or utilize our resources to have that person who can help organize and orient and move the system forward, which is going to result in better care. It's going to result in warm handoffs. It's going to result in conversations that need to occur between providers so that we don't lose someone between the cracks, so that those tragedies don't happen, and that we can create a better healthcare system that recognizes all of healthcare needs to work together toward the same goal.
I just want to say just a huge shout out to our community providers because they are really putting forth the effort. It would be, one thing if I was kind of doing this by myself, but it really isn't. And I don't want to say that we have it all figured out because we are all constantly learning. But I do want to say thank you so much and a shout out to our providers because they are really the ones that are making it work. And so props to them.
Well, and I was actually going to say the same thing. I can tell you don't really want to make this all about you, but we are going to put some links on for how people can reach you because they may have questions about how to do this too, and you'd be the perfect person to point them in the right direction. So we do have some links in the show notes today, how to reach out to Jill, learn more about who she is as a person. She's not going to take credit for those community providers. We can just tell. But she knows people, so she'll network you with the right people to help you point in the right direction. And that's the coolest part. That is one of the parts that Jason and I love the most about this job is the network of people that we've met and that we know if we don't know something, we can almost guarantee in behavioral health we can find somebody who does. And because we've met so many cool people. And so you're right. When it's not about taking credit and it's about making everybody go in the right direction, it's just a lot more fun and you meet a lot more cool people. And man, people are working really hard in our state and our rural communities to do good stuff. And so it's awesome that we got the opportunity today to highlight that. But before we go, we always talk about the recovering politician self-care policy of the week. So Jill may not know this, but I was a politician a decade ago and I'm still recovering. It was rough. And so every time we talk about self-care, and this time of year, I'm thinking about what are my goals going to be for 2025. And my life and season is a little different right now, doing more of the parole work and letting Jason do most of the business work. And so I've got more personal things, I think, on my horizon this year. So I take time now to just start writing a list of like, what would be fun? What would be cool? What would I like to do? And sometimes, for me, a goal needs to be fresh. It needs to be exciting and new. If it's things I've always done, I'm just not going to do it. And if it's boring, I'm certainly not going to do it. That's against my personality. And so I'm always working right now thinking about like what I'm going to do. And I don't have that list yet. I'm just starting to really kind of brainstorm and kind of think about it because it takes me a while to kind of come up with what I want to go. But Jason, have you had any thoughts at all for 2024 of what, or 2025, excuse me, of what you might want to work on this year coming up?
Can I redo 2024? No, 2025.
Let's don't do that again. Let's just start 2025.
I think this is my transition from running because I'm struggling getting my runs in. I'm going to have to start cycling. So I think I'm going to start transition, which I need to be doing more, mixing it up anyway. But I'm getting to that age where I'm probably going to need to look at other ways to get those workouts in and kind of try to find other ways that are reduce the stress a little bit on parts of my body. So we're looking at, what are other things that I can do that can fill that time, right? Because being out running, being active is really important to me. And so maintaining
we
my
know
health,
a guy. We know a guy.
I know a guy. He's going to help me. He's going to help me set up my bike. So,
cool.
I think it's just thinking about, as we go through different stages and phases of our lives, we have to think about how do we adapt? to different things. And sometimes the things we've always done don't work anymore. And so that we got to start to find different ways to do those
That's right.
things. And so I'm excited to do that.
That's right. So before we go, Jill, would you like anything you'd like to recap?
Yeah, I just want to briefly touch on, just say, so we have passed 2 years. We're on year 3 of this project. And so future goals that we have include now focusing on employers and workforce, which I know you've just had a couple episodes on that.
Yeah.
So I think we're all kind of on the same page there. And then hosting more community-wide. I've been kind of provider-based for that communication, but I think reaching out into the community more and expanding that and finding partners to help expand that as well will be good. And then, of course, looking for additional project funding, always on the plate. But really, I guess my parting words now after that are, communities are really only as strong as the people that make them up. And so I really encourage people to invest in educating yourself about resources in the community. So hopefully before you need them, or your family or your friends or your colleagues or your neighbors, people generally tend to avoid what makes them uncomfortable, but really take the time to attend a training or a presentation or a community discussion. Most of these have no charge to them. There should be nothing that is stigmatizing about learning. And just be kind. Each act of kindness is really an act of prevention.
That's
Just be
awesome.
kind. So thank
Be
you
kind.
both, for having me today and
We're
wanting
so
to
grateful
learn
you
about
came.
LINC
Thank
and
you.
the work that we're doing.
Yeah, so just to recap today, we talked about what's going on up in Northwest Iowa in the town of Spencer, which we didn't even mention this, but how amazing that this is happening. And you had that horrible flood too. You didn't even mention it. You're going through this trauma of rebuild, and this is still amazing work going on. So some people use those as excuses as to why we can't do things. And you're showing that you still have the amazing people in the community, even though you're working to rebuild, and can still do this. And so today we have some links in the show notes that are going to be just amazing. This local initiative for networking collaboration LINC, we're going to show you what they're doing up there. This is a model. It's not a perfect model, but they're making progress and bringing people to the table. And this is what it's all about. So if you want more information, dive into the show notes. Thanks again, Jill, for being here. It was amazing to meet you. Hopefully I'll come up to Spencer and see you in person one day soon. Thanks, everybody. See you all next week.